I'm delighted to welcome again Professor Claire Harrison, who's standing in for Claire Woodley, who's sadly unwell, to talk about symptom management.
So I'm not going to do such a good job as Claire Woodley would do, and she is going to record her talk and make it available to you. But we did want to cover symptoms because that might bring up some questions that you might want to play back to us in the panel discussion. So this talk concerns some management of symptoms, but also some data about how common we think symptoms are, but we're still on a journey and learning about that. So much of the data we have about symptoms has come from the work of my lovely friend Ruben Messer, who will be joining us at lunchtime. There's quite a lot of jet lag time difference between Texas and London. And colleagues across the world who've participated in studies, and some of these, the biggest ones of these are called the landmark studies. Maybe you've heard of them before. If you haven't, there's quite a lot of data about them on our website, and also you can find it on the internet. So the first landmark study was done in the US by Ruben and colleagues, and then we ran a study across some European countries, Australia, Canada, and Japan. And I'm pleased to say that the UK, as you will see, contributed by far the largest number of patients. And in fact, they had to turn off the UK stream for patients. And that actually was because of MPN Voice, MAS, sending out the information. So thank you very much to all of you who've participated in that. So overall, there were about 100 and nearly 180 patients with myelofibrosis, and you can see the other numbers. And there was also some data from physicians, and I'm not going to show you that data, but Claire will do a more detailed presentation and share it with you online. And what was collected was about symptoms, the physical impact. Alice shared so beautifully the impact of her symptoms, and so did Michelle, but also the impact of the diagnosis and treatment on your lives. So we know that symptoms are very common. About 90% of patients in these surveys experience symptoms over the course of a year. I'm not sure that I believe this, but apparently women reported a higher symptom burden than men. Maybe all of you men in the room are suffering in silence, I have no idea. Or maybe we're more expressive, I don't know. But so one of the key symptoms and the commonest symptom is fatigue. And that's something that we have focused on and we still need to focus on, and we struggle with. We struggle with medically understanding fatigue, measuring it. We can't put it through a machine and give you a number. We don't have a drug that works for fatigue. So this is something that's a big priority for us as a UK community of doctors who are interested and nurses who are interested in MPN. Yesterday at the Clinicians' Day, there was an OT and a physio who provide support for our patients at Guy's. So fatigue is a big issue for us, but we also note that the majority of patients experience some reduction in their quality of life due to having an MPN. And no greater has that been emphasised than in the last 3 years due to the pandemic and the inequality for MPN patients who have had to shield and have been worried. So I think we really acknowledge that. So what do patients say about fatigue? So there are some quotes on this slide. Some days it feels like I'm wearing a spacesuit and being made to walk underwater. Even the simplest task is an uphill struggle. And there are other quotes here. So fatigue, we define medically in some of these quotes on this slide. So it's a persistent subjective sense of tiredness related to cancer or cancer therapy, interferes with usual functioning. So that's the NCCN, a US body definition. In some places it's described as a complex symptom. It certainly is. Other definitions include reflecting how multifactorial it is, that it can relate to medication, to having low blood counts, to having inflammation, to different nutrition, psychological distress, pain, exercise, lifestyle, sleep, etc. So quite tricky, and tricky to manage and tricky to advise on. So Claire has put together this slide, which will be available online, but basically what she suggests is that, you know, you should monitor your symptoms, use the diary, use the app when we develop the app. Discuss this with your medical team or your clinical nurse specialist. Consider alternative causes. Think, am I more tired after I've had a long and busy day? All of us are going to be tired this evening, but, you know, but invigorated, hopefully. So plan that. We can put in place medical support, assessment, for example, advising about exercise, advising about nutrition, support you in setting goals, balancing out, planning, prioritizing, for example, using relaxation. Many of us probably felt fatigued because we were busy during the pandemic, but also fatigued because we were stressed and maybe we weren't sleeping well. So I can share that I'm somebody who finds mindfulness very helpful. So when I was waking up in the middle of the night thinking, how am I going to get all these medications to all these patients, and how am I going to cope without knowing their blood counts? I was using mindfulness to try to relax and get some good sleep. Itching is another common symptom for MPN patients. A few quotes here, but remember that itching can be due to other causes. For MPN patients, it's typically associated with change in temperature or contact with water, and it may not always be something that you would define as an itch. It may be prickling, a prickling sensation, for example. Some things that we use medically to manage itch are managing the triggers. Make the shower really hot, make it a bit cold, pat yourself dry. We sometimes advise on avoidance of chemicals to stop your skin being so inflamed. If you're putting a cream on, we use quite a lot of potions. Maybe put it in the fridge so it cools your skin. We can use drug therapy, and we can also use UV light therapy. And some of our medications do make itching worse. We know, for example, that often when patients first go on interferon, they may get more itching, but usually settles over time, and ruxolitinib is quite good at controlling itch. Another symptom that Claire has pulled out is brain fog. So it can be a difficult symptom to explain, and it can be a symptom again of the condition, a side effect of treatment. So some patients define that as chemotherapy brain. I lose track in the middle of a conversation and really have to concentrate on what people are saying. It's mental fatigue. Sometimes I can't find the right words for what I'm trying to say. I'm struggling with that this morning up here, or remember names. So it can be quite variable. So she has listed again some advice, and we'll make these slides available. And I'm not going to go through them in great detail today, but a lot of this is around talking to your team, keeping a track, seeing if there's a pattern, make sure you sleep enough and you get good rest, get into a routine, get someone to review your medication. Not every medication suits everybody. We also use the term microvascular symptoms. What does that actually mean? Well, Alice explained that to you better than I could. So microvascular symptoms, we think, are due to the platelets, for example, sticking together in the small blood vessels. That can cause headaches, the problems with hands and feet that Alice showed you, dizziness, ringing in your ears, medical term there, tinnitus, migraines. And usually this symptom does go away with an antiplatelet agent or lowering the blood count. But it can also be a trigger, for example, of maybe when your blood count might be going a bit higher, going a little bit out of the range. So that's all medical symptoms, but there are other symptoms that we need to acknowledge and work together to support you with, or for you to direct you to where to find support. So emotional impact, physical hardship, being anxious or worried. So this is some data on this slide from the landmark study. And you can see that's common. It's not only patients with MF or only patients with ET, and many patients are worried that their condition could get worse. And that's why when we pulled together the programme for today, we had Donal speaking about transformation and prognosis, because we know that's a common question. And there are also sort of wider impacts on daily activities, impacts on sex life, impacts on the family and social life, impacts not only with the family, but also with work colleagues or caregivers. So these are things that we can't always get better, but we can help our work with a team, work with your family to try to get support with. Sometimes that involves talking about it. We know from the landmark study that around 20% of patients with an MPN will have reduced their hours at work, voluntarily terminated their job, or taken early retirement. This, for me as a clinician, was a complete eye-opener when I saw this. I hadn't realised that. So this was something that I really learned from this. But seek help from your medical team in speaking to your employer, in speaking to occupational health, etc. You can track symptoms. There are many tools that are available online. We at Guy's Hospital have a tear-off sheet of paper which we hand to patients in the waiting room, and some of our patients use a symptom tracker app, which I'll talk about on the next slide. But we find that can be very helpful, and I know there are some people in the audience who also find that helpful. It's not mandated, but it can be useful, especially if you're thinking about, well, I'm going to try yoga, or I'm going to buy Alice's recipe book and try that for 6 weeks. Take a snapshot of the symptoms before and then afterwards. Online tracker apps are available. There is the MPN tracker, which is made available by Novartis, and MPN Voice has got an aspiration to pull together an app which will contain symptom trackers, but also contain ways of tracking your appointments, blood counts, and also measuring other things that might help and directing the app user to sources of help. So I know I haven't done this slide the justice that Claire Woodley would have done it, and I'm sorry that I'm not her, but unfortunately she has an upper respiratory tract infection, so she's not here today. Thank you.
Thank you, Claire.